everyone, I'm Dr. Nick Circolone. I'm so excited to be here as always. Today, we're going to extend our show from last week. Last week we were talking about low back pain and how the facet and the discs act when they're inflamed, irritated, damaged. Well, today we're gonna do some exercising to help with low back pain. In a lot of instances, it'll help for both, whether it be the disc or the facets. My personal today is gonna be more about a facet. Just so happens, I was working out the other day doing legs and I injured my back. I did about an hour of legs and chest and I irritated that low back. As Uncle Vinny would say, don't forget leg day. And I didn't forget leg day, but I injured my back a little bit, so my facet's a little bit irritated. So today, the stretches that we're gonna do, we're gonna be focusing a little bit more on the facets. Since I've injured that, bear with me, there may be certain moves which are a little bit more difficult. Maybe not, we'll see how it goes. So let's get started. The first thing we wanna do is we wanna warm up the body. The way I warm up my body is just kind of a walking in place, making sure that I'm moving and getting that blood flowing in my body. Also, you wanna make sure that you're wearing either good shoes or bare feet, doesn't matter. I actually have carpeted floor, so we can use that, but I have a mat in case you wanna use a mat. You wanna walk in place for about maybe 5, 10, 15 seconds, and then what you wanna do is you wanna just kinda go side to side. Now I know this looks really rudimentary. There's nothing new under the sun. What I'm gonna show you today is not something that, oh my gosh, it's the best thing that ever he's invented. No, these are kind of old but faithful kind of exercises and stretches that will help you. And remember, we're gonna be doing more of stretching than exercising. As I'm warming up my legs. Why am I warming up my legs? Because we're gonna be using the legs and the muscles as we stretch them. So we want them to be warm when we stretch them. We don't wanna stretch cold muscles. Not a good thing. We're also gonna be working on the upper half of the body. Why are we gonna be working on the upper half of the body? Because it's all connected. Your head all the way down to your feet. Now I like to do is a couple of little squats. Don't go deep. Some people can go really, really deep. I can do really deep. Just a gentle, and move your arms when you do it. Don't sit there like a zombie. Move around, make sure you're moving. So the first exercise I wanna do, we're gonna start with the neck. So we're gonna bend the head down, stretching it out. Now what I like to do is I like to just stretch it for a couple of seconds, and then I roll it to the right side. As I'm rolling to the right side, what I do is I take my left hand and I stretch it out. What this does is it stretches out the brachial plexus, stretches out the muscles of the neck. Some people get a little bit of tingling when they do this. That's because there's probably some degenerative changes that are in the neck that may cause the problem. Look down, stretch over to the left, get that arm and stretch it out. Now if you notice, what I'm doing is, let me turn sideways for you. I am not bringing my neck back. Your neck wants to be down, and then you want to lean it to the opposite sides, just like I am doing it here. Now, I like to do shoulder rolls. Now, when I do my shoulder rolls, you may hear some clicking and snapping because my shoulders are a little bit tight, so you may hear a little popping or cavitation of the joints. So you wanna roll them back once. I like to do it about 6 times. And if you look at it sideways, it looks like this. And I'm rolling these back. And then what I wanna do is I wanna roll it forward. What we're doing is we're just getting lubrication in those joints. We want them to move freely. Some people can't do what I'm doing. Do your best. Next thing we wanna do is we wanna stretch that out. And what I like to do is I like to take my arms and cross them over like this. So if I'm looking at it sideways, we're pushing down. I'm not lifting up, I'm just pushing down. Sitting up straight a little bit, and I'm rolling the shoulders forward. So you wanna roll those shoulders forward when you do this. Sometimes you wanna bring it up and stretch it out if you feel a little bit more ambitious. And also we take it from behind, like this, and drop that all the way down like that. And as you're stretching that out, you're gonna feel it. Now you're gonna stand up straight as you stretch this out. Get that chest out and relax. The key to all of this is breathing. If you've watched some of my videos before, I am big on diaphragmatic breathing. What is diaphragmatic breathing? We're breathing from our diaphragms. As we breathe in, we don't do that. That's not diaphragmatic breathing. That's breathing from your chest. It takes a lot of energy to do that. We want to breathe from our bellies. As we breathe in, our belly goes out. As we breathe out, our belly goes in. Out and in. And what happens is, this engages the diaphragm. As it engages the diaphragm, it pulls the diaphragm down, expanding your lungs. I want you to practice that. If anything you get today is learn how to do that diaphragmatic breathing. Take a look at one of my other videos. I talk about all about diaphragmatic breathing and how important it is. But for now, we want to try to breathe from our diaphragm. The next thing we want to do is we want to stretch out that top area. So What I like to do, and I've seen it done in a lot of other videos, is basically you come down for a squat and you come up and you stretch it out, stretch it out. Lean to one side, lean to the other side, and scrape the back of the walls when you do that. Also, you come down and you can either put your arms out and hold them out there as you're doing a stretching if over the head may be a little too difficult, or you can't reach up that high, because some people have shoulder problems and it really bothers them to do that. So we want to do that and then lean to one side. Also, what we want to do is we want to keep working those areas, and we want to stretch the shoulders. I enjoy stretching the shoulders like this. This is my way of doing it. Some people grab and pull. I kind of like this one the best, where I'm actually stretching this out. And this is getting my deltoid. It's also getting back here in my part of my rotator cuffs, my supraspinatus, and my teres minor. My teres minors are always tight and stretch out like this, just stretching it across. So what it looks like, if I turn sideways or on an angle, you can see where I'm pulling this. I'm not having my hand out here. It is across my body. Some people, you may only get to this point. Take your time and try to bring it as close to your chest and at a 90-degree angle from your face, like this. Not in front of you, but here. This does nothing. See what I'm doing here? This does nothing. You want to keep that arm straight and pulling it in under your chin. Try not to lift up when you're doing it. Just keep it in a neutral position and pull. Again, to the opposite side. You can pull if you want to this way, or you can just lock it in. The other thing that I like to do is I like to reach over the top. A lot of people do this differently. Some people do it where they reach across to the opposite shoulder, or they just pull it straight back and go straight down. I personally like both. So I pull it down, hold it there for a couple of seconds, and then I reach across to the other side and give it a little pull. This gets more of the triceps in there. From the front, straight down to the side, and as you pull, you'll get a little bit more of the lat when you do it that way when you reach from the opposite side. So with all of this, your body's now loose. I'm getting a little bit warm just from doing that. You're thinking, when is he gonna get to the low back? We're gonna start that right now. This one may be a little difficult for people. What I do is, I stand with my legs shoulder width apart, and I just reach my arms out and I slowly bend forward. You may only get to this point. You may only get to that point, depending on the facets. If you've seen the show last week, sometimes your facet won't let you get to this point. But once you get past that, you can lean forward and look down and kind of hang here. Sometimes I cross my hands, sometimes I try to touch the floor. As I come up, because I'm going to talk to you about this, when you reach down to touch the floor, don't bounce. I see a lot of people trying to bounce to do that. This is not a ballistic exercise. This is just a static stretch. Slowly bring your body down to where you can touch the floor. Some people like to spread their legs wider. Some people like to keep them together. I'm pretty much good at shoulder width apart. And as I lean forward, I'm just relaxing, breathing. Breathing in and letting it out. Breathing in and letting it out. I like to breathe from my nose and out my mouth. If you notice, I'm getting further and further every single time. Some of you may want to bend your knee. I don't want you bending your knees. If you can only get to here and you feel it in your hamstrings before you start bending your knees, stay right here. Don't get any further than that. Next, we want to, when we come up, catch our breath. If you're starting to lose balance, be careful. We don't want you losing your balance when you do that. The other thing I like to do is go a little bit further than shoulder width apart. Get down to that motion as far as you can, and then you want to go to the other side. You want to take your head and try to bring it to your knee best you can. Breathing the whole time. Breathe in, let it out, and slowly come back to center. Get your bearings, deep breath in, and then lean over to the opposite side and pull and breathe. Just breathe. This is a great way to get those muscles relaxing. The deep breath in, and when you let it out, you get further and further. Deep breath in, come back to center, and just come up slowly. Bend the knees slowly, and come back up. Right there, if you noticed, I can usually reach a little bit further. But again, because I injured that facet again, it's a little bit harder. Now you're probably wondering, Doc, if your back is hurting you, why are you able to do this? Well, those stretches actually make it feel better. What I tell patients to do is not do extensions right away. So what an extension is this. This will cause some pain and aggravation in those facets. So we want to avoid extension for a period of time. Eventually we'll be able to do them where we can do a cobra. The other thing I like to do at this point is to stretch out my calves. I like to stretch out hamstrings. And what we do is I go into what's known as downward dog. You can do it more of a yoga where you lift your arms up and reach down and touch the floor and then step back. Or you can get on your hands and knees to this point here. Bring your hands out in front of you, tuck your toes down and lift up and touch and stretch like this. And breathe as you're doing it. I like to stretch one side at a time. This feels really good, just kind of stretching that out. And I'm pushing back. Now, I see a lot of people that they don't want to push back because it hurts. Take your time doing that. I actually like to bring my legs up a little further, get more of a stretch, and just breathing through it. In through your nose, out through your mouth. What we want to do is we want to just get back on our hands and knees. This is called cat-cow. As we do a cat stretch, we bring our body all the way up. Oh, stretching it out, and then we let the air out. We arch our back and lift our neck. Now here is where I feel my facet, right there. It's irritating a little bit. Come back up, doesn't feel too bad. As I let it out, second time, not as bad. So here's the thing, as we start to get those joints to open up and move, what happens is they start to feel better because they only have motion. We want motion and we want flexibility. This is what's going to keep you young, motion and flexibility. Some of the things that I like to do, especially when I'm on the floor, because a lot of patients can't do what I just did. So we want to do some things that are on the floor. We want to stretch some of the muscles while we're on the floor. The one stretch where I was touching my toes while I was bending over. Another way of doing that is actually sitting up, and you can reach over and touch your toes, or you can take one leg at a time, reach over and touch your toes, like that. Some people feel more comfortable. They don't feel as unbalanced when they do that. They're afraid they might fall over. I'm okay with you doing it on the floor. There's no problem with that. But I like to do the one leg at a time. And I just stretch, and you want to pull this foot back, hold it there as you reach forward. And same thing, you want to take your head and touch your knee. Breathing the whole time. And then you want to come up really slow. And you want to do the opposite side. And breathe in, let it out, reach for it. Now remember, this is my right side. This facet's a little tight, but I'm still getting down there. Right now, I'm just stretching out that facet. Just stretching it out and relax. Again, some of you may not be able to do this. That's okay. If you can only get here, that's good. You're at least doing it. Trying a little further, a little further. Some people may be able to reach past their foot and literally rest their head on their knee. I can't quite do that yet, but I do some of it. So when you're in these positions, when you're doing these exercises, be comfortable. Wear comfortable clothes. Make sure you're either barefoot or you have a good pair of shoes on. Make sure you're in stretchy type clothes. Don't do these at the office when you're wearing tighter clothes. Also, each exercise you should hold for about 15 to 30 seconds each way. And then as you progress and you get further and further into the stretch, you'll notice that there'll be big changes in the way you feel. I told you before that I was having a little bit of facet type pain. My facet type pain has decreased considerably. I'm not one for taking medications. I'm just going to tell you. If I have to take an anti-inflammatory, sometimes I will. But if I can work through it by exercising and stretching, that's what I'm going to do. You want to be able to be still flexible even when you're in pain. My flexibility right now is still pretty good. I still have some facet type irritation and discomfort. If you have discomfort, don't do it. Modify it. Well guys, I hope you enjoyed learning a little bit about how to stretch for low back pain. I know it's very simple, but I guarantee it's gonna make a big difference in the long run. If you have any questions, you're not sure of how to do the exercise, you might need a little bit more instruction on how to do it, don't hesitate to leave a comment. Don't forget to subscribe. Don't forget to like. Have a great week. We love you. Talk to you soon.